Bizarre Medical Legal Cases Part 21. So this one we call secondhand cancer. And so it's a controversial topic that's occurring right now in the medical world, or rather the screening guidelines medical world, the USPSTF. And the past few videos I've been on this just because it's so fascinating to me, and it's tantamount to how we assess cases, like whether something should have been done or should not have been done. But anyway, so what we're seeing a lot of is that there are people that have never smoked a cigarette in their life, no tobacco use, etc. However, they grew up in households where the parents would smoke, or even a grandparent or what have you. So they've had years and years of secondhand smoke. And again, for smokers out there, we measure how much you smoke by pack years. And so now there's talk in the medical world of, can we quantify secondhand pack years? Because yes, you do get lung cancer down the line from secondhand smoke. Bizarre Medical Legal Cases Part 22. So this is more of a PSA. It's I call it Remember the Kidneys. So guys, doctors out there, all my fellow doctors, renally dose things in patients that have some sort of kidney disorder. Okay, it takes 2 additional seconds. Check up to date. Use Hippocrates Medscape app. But yes, we get a lot of cases where patients with ESRD or some sort of CKD, some sort of elevated creatinine, they're getting normal dosing of certain medications that are known to be nephrotoxic. Remember that if a person's kidneys are not functioning, or rather less functioning, that medication, and remember, we should not be on medications, right? Medications are alien substances. They're just flowing around the body, degrading, causing issues. So we get a lot of these cases. So please, everyone, remember to renally dose. Remember the kidneys. Bizarre Medical Legal Cases Part 23. So this one we call Flawed Phlebotomist, and huge thanks to the subscriber above who brought this idea. And it's insane that we actually had a case regarding this. So basically it was a routine blood draw that a patient was going through. I think it was a CBC. It doesn't really matter what it was. The phlebotomist was distracted, and there's the deposition from one of his coworkers confirmed that he was talking to someone else, and he actually broke the syringe while doing a blood draw. And this is something that I've actually never seen before. I've never heard of it when I was in clinical practice, but apparently it happens. But we were able to say that it's not a known complication. It was due to a distracted provider, and so the case leaned towards the patient. So justice served. Bizarre Medical Legal Cases Part 24. Ramadan Mubarak, by the way. We're halfway there. It's always sad when Ramadan ends, but, every year, inshallah. All right, so this one is called Dirty Water. And basically, it's a pretty new case. We received it about a week or 2 ago. And it's basically quite a few patients that became ill because of contaminated, or rather non-sterile, normal saline. That's basically the fluid that we give in hospitals via IV. And the company that basically sent out this non-sterile contaminated fluid, they were punished and there was an FDA recall, but unfortunately the FDA recall occurred about a week after this was discovered. So many people became sick. Some actually went into septic shock. But this case is actually ongoing, so hopefully justice will be served. Bizarre Medical Legal Cases Part 25. I can't believe we're a quarter to 100. Inshallah, we'll just keep going, and Ramadan Mubarak. All right, so this one is called A Translator Gone Rogue. And this is actually the first time I've ever experienced a case like this. And, it's still ongoing. It's a fresh case. So we'll see where it goes. Hopefully, it's quite clear that this will turn into a criminal case. But basically the story goes that a man died in the emergency room. His mother didn't speak English, and the translator basically coerced the mother into getting an autopsy, but the autopsy form was never signed. The emergency room physician also had no clue that this even occurred. So remember, guys, everything needs to be signed. You need to receive an informed consent form. And remember that you are in charge of your health and the health of your loved ones. No one can force you to do anything. Bizarre Medical Legal Cases Part 26. This one we call Blood Draw Pass Out. So it involves an adult man with a known history, that's important, of vasovagal syncope. Vasovagal syncope basically means that if a person is under a stressful or sort of traumatic situation, their heart rate, blood pressure just plummets, and it leads to fainting, and it can of course lead to falls. So a man gets a blood draw for just, it was a routine blood draw and a urine sample. He tells the phlebotomist that he's feeling very woozy. The phlebotomist says, well, go to the bathroom, go give your urine sample. The man falls, breaks his nose, and gets an orbital fracture. And the phlebotomist was successfully sued because it is part of their standard of care to assist with ambulation, especially if a patient is dizzy or has a known history of syncope. Bizarre medical legal cases, part 27. This one we call Guano, When Nature Calls. So we actually just had this case this last week, and I swear, if you know the reference, comment below. 10 points to Gryffindor if you can spot the reference. But basically, we received a case of a patient who basically had some sort of infectious process, some sort of infectious disease, was in the hospital for about a month, and no one could figure it out. The patient lived alone, had no next of kin, was basically in a comatose state because he experienced septic shock, and then basically couldn't speak or anything. So a barrage of tests were done on this patient, and by the end of about a month, a missing nephew came out of nowhere and said, oh yeah, my uncle used to raise pigeons. And so he was diagnosed with histoplasmosis.
Bizarre medical legal cases, part 28, the case of the bleeding kidneys. This case involves an otherwise healthy, 23-year-old female who suddenly started urinating bright red blood. She immediately went to the ER, and doctors were baffled as she did not have a UTI or an STI. She did not meet admission criteria, and her kidney function tests were grossly normal, and so she was discharged home. After being referred to multiple physicians, she was ultimately diagnosed with lupus nephritis, a rare manifestation of lupus SLE, in which the body's own antibodies destroy its kidneys.
Bizarre medical legal cases, part 29. The case of the missing pain meds. This class action lawsuit involved numerous patients who alleged had their pain medication stolen by a nurse. It was found that the nurse was pocketing the pain meds and selling them to her partners in crime. This was confirmed by CCTV recordings and the testimonies of many of the nurses' co-workers who suspected her. The nurse was ultimately imprisoned, and the patients compensated for their subpar medical care.
Bizarre medical legal cases, part 30. The 30-year-old female who was taking a very famous weight loss drug, which isn't really a weight loss drug. I think we all know which one I'm talking about. It's Ozempic. She was doing very well on it. She lost about 20 pounds in 2 months, which is insane. But of course, we don't know where she got it from because it wasn't prescribed by a licensed physician. Anyway, she lost 20 pounds, but she experienced immense bloating, immense intra-abdominal pressure, and she ended up with a cardiac arrest. Cause of death was known as sudden death. And so during the autopsy, they figured out that she actually experienced a cardiac arrhythmia from the increased intra-abdominal pressure, which ultimately led to the cardiac arrest and her death. For more on these drugs, check out our video below and subscribe for more bizarre cases. Bye. Bizarre medical legal cases, part 31. So this one involves a 14-year-old female who her grandma alleges plays online video games like Fortnite, Minecraft, and other games, and she alleges that playing all these video games have led to an addiction. And so this is part of a series of lawsuits brand new to 2024 called the video game addiction lawsuits. And she basically alleges that because of playing video games for such a long time, her grandchild has lost the ability to learn. And she also claims that her attention span has also reduced to a horrible level. To learn more about the video game lawsuits, click on our link below for the full video.